Hey, my name's Eric, and I'll be introducing our presentation on oncology. Cancer remains one of the leading causes of illness and deaths worldwide, affecting millions of people each year. Because of its widespread impact, understanding cancer and the field of oncology is essential to anyone entering the medical field. By the end of this presentation, you should be able to understand the basic anatomy and functions of the breast and prostate, recognize the common signs, symptoms, and risk factors of breast and prostate cancer. Explain the tests and procedures used to diagnose each type of cancer. Explain the different stages of breast and prostate cancer and how they affect treatment. Identify common medications and treatment options used for breast and prostate cancer. And finally, understand why early detection and routine screenings are important for improving patient outcomes and quality of life. Before discussing specific cancers, it's important to understand what oncology actually is. So, oncology is the branch of medicine centered on the prevention, diagnosis, treatment, and research of cancer. Physicians who specialize in cancer care are also known as oncologists. Oncology includes early detection, treatment planning, symptom management, and long-term follow-up. Depending on the type and stage of cancer, treatment may include surgery, chemotherapy, radiation therapy, immunotherapy, targeted therapy, and hormone therapy. Many people are familiar with oncologists, but not everyone knows the education and training required to become one. The journey begins with earning a bachelor's degree. That can roughly take about 4 years. After medical school, physicians complete a residency in related specialties such as internal medicine, general surgery, and radiation oncology. They then complete an oncology fellowship, which usually lasts 2 to 3 years and provides specialized training in cancer diagnosis and treatment. After becoming board certified and obtaining state licensure, they continue lifelong education to stay current with advances in cancer treatment. All this altogether typically takes about 13 to 15 years of training time after graduating from high school. There are several different types of oncologists, each specializing in a different aspect of cancer care. The first one is medical oncologists. They treat cancer using chemotherapy, immunotherapy, targeted therapy, and hormone therapy. Surgical oncologists. They typically remove tumors and perform cancer-related surgeries. Next, we have radiation oncologists. They use radiation therapy to destroy cancer cells. Pediatric oncologists treat cancer typically in children and adolescents. Gynecologic oncologists specialize in cancers mainly of female reproductive system. And last, we have hematologist oncologists. They treat blood cancers such as leukemia, lymphoma, and multiple myeloma.
First, I'm going to discuss prostate cancer. The prostate is a small gland found in the male reproductive system. It is located directly below the bladder and surrounds part of the urethra, which is the tube that carries urine out of the body. The prostate also produces fluid that helps nourish and transport sperm as part of semen. Prostate cancer occurs when abnormal cells within the prostate begin growing and dividing uncontrollably. As these cells continue to multiply, they may form a tumor, like the tumor shown in the diagram on the right. Many prostate cancers can grow slowly and may remain limited to the prostate for several years. In some patients, the cancer may not immediately cause noticeable symptoms or require aggressive treatment. However, other forms can grow more rapidly, invade nearby tissues, or spread to the other areas of the body. When cancer spreads beyond its original location, that is known as metastasis. Because the prostate surrounds the urethra, changes in the prostate may affect urination. However, urination symptoms do not automatically mean that a person has prostate cancer, because other non-cancerous prostate conditions can cause similar problems. Overall, prostate cancer can vary significantly between patients, so early evaluation, proper diagnosis, and determining how aggressive the cancer is very important when selecting the most appropriate treatment.
So we're going to be going over the anatomy and physiology of the prostate. So for the anatomy of the prostate, it's a walnut-sized gland in the male reproductive system. It is located below the bladder and surrounding the urethra. Um, Obviously, the prostate is only in males; it's not in females. On top of that, it's composed of glandular fibromuscular tissue organized into lobes and zones. If you look at this picture over here, you can see that the prostate is highlighted in orange, and on top of that is the bladder. So, what does the prostate do? It produces and secretes prostatic fluid, which contributes to semen composition and helps with sperm motility and ejaculation under androgenic regulation. Prostate growth and secretory activity are regulated by androgens, specifically dihydrotestosterone. It's a metabolite of testosterone. Now, for pathology and pathogenesis of prostate, so for prostate pathology, it begins in the glandular cells known as adenocarcinoma. Cancer cells take over healthy tissue to form abnormal glands, and prostate cancer is based on a Gleason score. And depending on what stage of cancer for prostate that you have, it determines the cancer aggression and the treatment needed to help cure the cancer. For pathogenesis, androgen receptor and genetic mutations create uncontrollable prostate cell growth, promotion of tumor growth with testosterone and DHT, and if the cancer does get out of hand, it can spread into the lymph nodes, liver, lungs, and bones, which would make that malignant. For the risk factors of getting prostate cancer, age is one of them. Once you're about 50, you do want to go get checked to make sure you don't have prostate cancer or, the possibility of you getting it. For race and ethnicity, usually if you're Black or from African ancestry, anything of that nature, you are more prone to get it. And family history and genetics. So if you have anyone in your family tree that's, right next to you in the family tree who've had it, you are more prone to get it. And smoking, obesity, STIs, those things already affect your immune system. So of course, that's going to raise your probability of getting it.
Cancer has a couple of signs and symptoms that will show you or warn you if you should be concerned and see a doctor. Some of these might look like blood in the urine, which can cause the urine to appear pink, red, or soda colored. There might be blood found in your semen, or you may feel the need to urinate more often than normal. You might have issues with getting started when attempting to urinate, and you might be waking up throughout the night to urinate more often than you would have already been.
I'm going to be talking about the medical history and examination process for prostate cancer. Some medical history or signs and symptoms that are associated with prostate cancer include patients coming in with trouble with urination. This could be them having a weak flow, pain or burning while they're urinating, or their urine containing blood. The patient may also have trouble controlling their bladder and the bowels, and they may experience erectile dysfunction. People who are more prone to developing prostate cancer are older patients, as well as patients with a family history of prostate cancer. Also, patients that have genetic mutations such as Lynch syndrome or inherited genes, the BCRA1 or the BCRA2 genes, are also at risk of developing prostate cancer. Ways that patients may increase their chances of developing prostate cancer are them being a longtime smoker, them being obese, or contracting STIs. Also, having prostatitis sometime in their past will also increase the chance that they may develop prostate cancer. Some examination procedures that are associated with prostate cancer are the digital rectal exam, which is the more commonly known one, where the medical provider inserts their gloved, lubricated finger into the patient's rectum, and they feel the prostate. They're just looking for any indicators that may point to prostate cancer. They're looking for any bumps or hard areas on the prostate. They can also order a prostate-specific antigen blood test or PSA blood test. PSA is a protein that's secreted by the prostate gland. High levels of PSA in the blood may indicate cancer. That's not always the case. It could show under other conditions such as benign prostate hyperplasia or prostatitis. Um, Another examination are MRIs or transrectal ultrasounds. These just show the images of the prostate gland as well as the surrounding areas. It just helps the provider decide whether or not they need to order a biopsy of the prostate. And then there's the biopsy, where the medical provider removes the tissue sample from the prostate or any of the surrounding area and runs it through some tests to decide and see whether or not cancer is present. It also lets the medical provider know if cancer is present, it shows how aggressive the cancer is. And the biopsy is the only way of knowing whether or not cancer is present.
Now we're going to talk a little bit about the diagnosis process. The examination process has just been discussed, but the diagnosis process is a little bit more of the sequence of tests done to diagnose prostate cancer. So the first thing done is normally a digital rectal examination. Most patients end up having normal DREs. Physicians ask for request a prostate-specific antigen blood test that is done and analyzed in context of the patient's clinical status, including the comorbidities, age, familial history, and if the provider thinks it's necessary, they will recommend a transrectal ultrasound guided biopsy. Um, then going into our stages of pathology. Um, So, knowing the stages of prostate cancer helps us better understand the cancer and accurately discuss treatment options. Um, the different tumor stages gives us a more systematic way to describe the amount of cancer and the extent of the cancer in the patient. The TNM system, which is tumor, lymph node, and metastasis, is what is currently used to determine what stage the cancer is at. It's always being studied and changed a little bit since it was first established. But each of the components in the system have their own grading system that gets combined to give an overall stage of the cancer. Um, so the first stage is just localized or early. The cancer is really small and it's only in the prostate. Stage two is still localized and early, but the cancer is a little larger and could be in both lobes of the prostate, but it's still just in the prostate. Stage three, it's locally advanced or regional. The cancer has spread beyond the prostate to the nearby lymph glands or seminal vesicles. And then stage four, it's advanced or metastatic, which is when the cancer has spread to other body parts, such as the bones, liver, or lungs. It's referred as metastatic or advanced prostate cancer. If the prostate cancer spreads or metastasizes to the bone, you don't have bone cancer, it's just prostate cancer in your bones. Um, so for specifically for prostate cancer, a grade group is also used to classify the cancer. It comes from the Gleason score, which is given by analyzing a biopsy. It's used to estimate the aggressiveness of the cancer. The number of this for the scores comes from how common certain cell types are in the given sample. But it is kind of a hard for us to understand and to get this score. So they made up the stage groups, which are also used to just simplify the classification. So grade group one is just the tumor tissue is super differentiated. It's not aggressive, it's less aggressive and likely to grow more slowly. Grade group two and three, the tumor tissue is moderately differentiated, moderately aggressive, and likely to grow, but it's not going to spread that quickly. And group four and five are that the tumor tissue is poorly differentiated or undifferentiated, and it's highly aggressive and likely to grow faster and spread.
Commonly used medications for prostate cancer. Some common prostate cancer drugs include the following. The different drugs I have listed are different types of therapies, including immunotherapy, hormone therapy, chemotherapy, and targeted therapies. There are many different options when it comes to medications for prostate cancer, and sometimes it takes a few to find the right one. These cancer patients go through a lot of ups and downs to find the perfect fit for them. These medications can have different effects for different people, so it's necessary to be aware of all the different side effects. There are several different risk factors that can increase the chances of getting prostate cancer. Men are the only sex that can get prostate cancer because women lack a prostate gland. Age is another factor where men older than 50 have an increasingly higher risk than those younger than. The risk also increases for African American and Caribbean men of African ancestry. Although the likelihood is not very high, there is still a chance of obtaining the prostate cancer through family history. There are also certain gene mutations that have been accounted for that will increase men's risks. Other risks include those that are very adjustable. For example, smoking, alcohol consumption, bad diet, and obesity.
Breast cancer is a disease in which abnormal cells in breast tissue grow and divide uncontrollably. As these abnormal cells accumulate, they may form a tumor. To understand how breast cancer develops, it is important to recognize the basic anatomy shown in the diagram. Breast tissue contains ducts, which are small tubes that transport milk, and lobules, which are glands that produce milk. Most breast cancers either begin in the ducts or in the lobules. Initially, abnormal cells may remain contained within the area where they first developed. When cancer cells break through the surrounding tissue and begin growing into nearby structures, the cancer is considered invasive. Cancer cells may also enter the lymphatic system or the bloodstream. These systems can transport the cells to lymph nodes or distant organs. The process of cancer spreading from the breast to another part of the body is also called metastasis. Although breast cancer occurs much more commonly in women, it is important to understand that anyone with breast tissue can develop the disease, including men. This is why changes such as a new breast bump, skin changes, nipple changes, or unusual discharge should be evaluated by a healthcare professional. The specific type and behavior of breast cancer can differ from one patient to another. Therefore, identifying where the cancer began, where it has been invaded by nearby tissue, and whether it has spread helps healthcare providers determine its stage and develop an individual treatment plan. Although prostate and breast cancers begin in different tissues, both involve uncontrolled cellular growth and have the potential to invade nearby structures or metastasize. Next.
Now I'm going to be talking about the anatomy and physiology of the breast. So the anatomy of the breast, it's a complex glandular organ composed of mammary glands, lobes, lobules, connective tissue, fat, and a network of blood and lymphatic vessels. Each breast contains 15 to 20 lobes arranged like petals of a daisy. The center of the breast is the nipple and surrounded by the areola, which contains Montgomery's glands. So if you look over at this picture over here, you can see that the pink part that's in the breast that's sticking out, that's going to be the nipple. I know it's kind of hard to see it on here, but around that, it's going to be the areola. And then these pink uh, things right behind that is going to be Montgomery's glands. So for the breast, the primary function is to produce milk and deliver it, which is regulated by hormones such as estrogen, progesterone, prolactin, and oxytocin. The Montgomery's glands around the nipple secrete lubricating oils to protect the nipple during breastfeeding. For pathology and pathogenesis of the breast, so breast pathology, breast cancers are carcinomas which originate in the ducts or lobules. Tumors are classified by their histologic, type, grade, and receptor status. Breast cancer is molecularly heterogeneous, where different tumor subtypes will have different behaviors and treatments. So depending on the type of tumor you have is going to depend on, I guess, the aggression it has and the treatments that are specific to that. For the pathogenesis, it develops from epigenetic and genetic changes, which will cause uncontrolled cell growth. Tumors develop in the milk ducts or lobules, increase cancer development by estrogen signaling, HER2 activation, and BRCA1/BRCA2 mutations. And as the cells spread, they can go to the organs and tissues that are nearby the breast. For risk factors of the breast, so family history and genetics. If you have someone in the family tree who's close to you in that tree, and they did have breast cancer, you are more prone to get it. If you begin your period before the age of 12, or if you're starting menopause late after the age of 55. Um, Another one that's very important is if you were at a young age and you had some type of exposure to radiation whenever you were young, that can also lead to future complications in having breast cancer. Another final one is having children at an older age or not being pregnant at all.
That you should be aware of whenever checking yourself or someone else for breast cancer. A few things that might indicate breast cancer could be a lump or thickened area of skin on your breast, a nipple presenting flattened or turned inward. There could be irregular changes of color, change in shape, size, appearance of the breast, or changes to skin that's over the breast, so it may appear to have a change in texture. And then there may be irregular scaling, crusting, or flaking of the skin on the breast.
Now I'm going to be going over the medical history and examination processes associated with breast cancer. Some signs that a patient may come in for is they'll notice changes in the shape or size of their breasts. They also may notice a mass or lump in or around the area of the breast, which can also sometimes include the underarm. The patient's breast may start to look or feel different than it normally does. The breast itself can be dimpled. The skin can become scaly or inflamed, and in some instances can even change color. People who are more prone to developing breast cancer are older individuals, females, and people who have a family history of breast cancer. Ways that people can increase their chances of developing breast cancer are by smoking, drinking alcohol, being obese, undergoing hormone replacement therapy, or being exposed to excessive amounts of radiation. Some examinations include the physical examinations and or mammograms. These are where providers will check for any signs and symptoms of breast cancer. And if it's necessary, they'll order breast ultrasound or breast MRI. These are used to get pictures of the breast tissue to diagnose any uncertainties or the abnormalities that they felt during the physical examinations or mammograms. And then if it's necessary, then they'll order a breast biopsy where a sample of breast tissue is taken from that suspicious area, and then they'll run it through some tests to see if the patient has cancer, and if they do, how aggressive it is or what stage of cancer that they're in. And then there's preliminary genetic tests where providers will just see if a person is more at risk of developing breast cancer. They're just looking for the mutations in the BCRA1 and BCRA2 genes in particular.
So again, the examination process just discussed some of the diagnostic methods that are used. I'm just going to add a little bit of more information to that. So physical examinations and mammograms are preventative measures. Physical examinations can be done by yourself, on yourself. Um, but whenever you go for your yearly checkup with your doctor, they can also perform those physical examinations. Mammograms are recommended once a year, for women over 40. If any abnormalities are found in either of these, your provider might request another imaging exam, um, like MRIs, PET scans, CTs, SPECT scans. Um, if there's anything abnormal, any tumors or anything found in these other imaging exams, then they are most likely to request a biopsy to be done, along with blood tests to analyze the biomarkers that the cancer can give. Now, talking a little bit of the stages of pathology for breast cancer. Um, so again, like in prostate cancer, knowing the stages of breast cancer is really important to plan your treatment and understand the prognosis. There's two types of staging for breast cancer. The clinical prognostic stage um, is determined by your health history, your physical examination, your imaging test, and the biopsy findings. And then the other um, staging process is the pathological prognosis. Um, it can only be used for people who have already gone through surgery as their first treatment. So they found out about the cancer and they immediately do the surgery. Um, and then all of their clinical information is also taken into account, along with the status for certain biomarkers that they're going to analyze from the tissue removed, like hormone receptors and growth factor receptors. Um, and then the tissue that's removed is obviously breast tissue, and the lymph nodes that are removed, and that's where they get the results for these biomarkers. And like the prostate cancer, the TNM system is used pretty much the same way. So the only difference is that breast cancer does have what they call stage 0. And that is it has abdominal cells that are found in the breast tissue, but they have not spread to nearby tissue, so it's just on the breast tissue. Stage 1 is early stage. The cancer has spread to other tissues in a small area. Stage 2 is still localized. The cancerous tumor may measure 15 millimeters or larger. If there are no lymph nodes, when lymph nodes are involved, the tumor may measure between 20 to 50 millimeters. Stage 3 is regional spread. So the tumor is measuring larger than 50 millimeters, and the lymph nodes are spread across in a wider region. And in cases where there's no tumor, cancer may spread to the skin or the chest wall. And then stage 4 is a distant spread, so the cancer cells have spread to other parts of the body.
Commonly used medications for breast cancer. The most common breast cancer drugs include the following. There are many more medications that are used for breast cancer. However, the medication truly depends on the individual. Depending on symptoms and the differences amongst everyone with breast cancer will show what medication will be used to treat each person. When it comes to breast cancer, there are several different therapies that could help an individual feel relief or become cancer-free. There are options like hormone therapy, chemotherapy, targeted therapies, and immunotherapies. Concerned populations for breast cancers include the populations who are more at risk for getting breast cancer are women. Although it is extremely rare, men can receive a breast cancer diagnosis. One of the few malignancies that runs in families or is caused by genetic abnormalities is breast cancer. Additionally, some demographic groups, such as African American women and white women, are more vulnerable than others. Individuals over 50 are more likely to receive a diagnosis, and women who typically have higher breast densities are also more vulnerable. In addition to the uncontrollable elements, there are risk factors that can't be changed, which include excess alcohol consumption, being overweight, and reproductive and menstrual history.